Welcome to another edition of the Dental Today podcast. Thank you for stopping by. This is brought to you by labmediatv. My name is Hezekiah Morales, and here we go. Remember to follow us on social media at labmediatv. Welcome to another edition of the Dental Today podcast. We are very excited to have Miss Amanda Rowe with us. We're talking about a third generation dental professional. I'm so excited to go into it. Amanda, welcome to the show.
Thank you. Happy to be here.
So excited to have you on the show. When I was reading a little bit on your profile, your tag, your actual handle is 3G Dental Pro. So I'm assuming that stands for third generation dental professional, correct?
Dental prosthetics, actually, but yes.
Okay, how amazing is that? Awesome. So tell me a little bit about this. Third generation, how did this all start? With your grandpa, how did this start?
Yes, my grandfather was a denturist. I'm not sure how many years he practiced, but my father is also a denturist, and he's been practicing for about 38 years now. And he's practicing in Idaho and Washington, so he's dually licensed. And he works in both states every day. He actually has a clinic in Coeur d'Alene and in Spokane, and he commutes between the cities. It's about 25 miles. Works at one clinic in the morning and one clinic in the afternoon. And then I became licensed, and so that makes me third generation in our family for that.
So how did this happen? Did you one day, how did you get involved in the family business, if we can call it that? And how was this really determined in your life and your progression that this was where Amanda was going to shine?
Well, I actually grew up in the clinic, like literally. At one point in our lives, when I was very young, we lived in the clinic, in the lab. I was probably 2 or 3, or I was born in 87, so I think it was like 1990, 91 when my dad was first getting established. And at a point in our lives, we lived in the clinic, and he was setting teeth, and he would say, "Amanda, come here," and I'd be on my hands and knees searching for a tooth he dropped on the lab floor while he was setting teeth and things like that. So I was involved, from as early as I can remember, and playing in the lab, making plaster handprints and things like that. And then as I got older, when I was a teenager, I started working for my dad in the lab. Started first just cleaning and taking out garbage, and then as I learned more and more, I could pour models and stir plaster, and that's kind of where I started. And I just progressed from pouring models and being in the plaster room to eventually I was finishing in polishing and repairs, and graduated onto setting teeth side by side with my dad. And until I was well versed in almost any area of his laboratory, and I did that for many years, all through high school, until I went away to college.
Wow! But so absolutely, the environment was conducive to that profession. But in any step of your development, did you ever consider anything else?
Oh yeah, very much so. So I went to college. I went to Arizona State University, and I majored in English literature and justice studies. And I majored in literature and had my minor in justice studies. And I did a study abroad, and I studied at Cambridge University in England, and I studied like Arthurian legend and just the humanities and the arts. And I was going to go on to law school. That was my plan. when I was nearing graduation, and my dad called me on the phone, and I had also attended many continuing education conferences as my dad raised me. So he would take me and my sister to all the conferences with him. So I was, I saw that scene of it, and he was like, right when you graduate, you should apply to this program at Bates Technical College and see you have the background for it. You have all the necessities to be accepted into this program. And I was like, well, I want to go to law school, and I also want to take time off. I was ready to be done with college for a little while at that time, and he said, they have a waiting list. Why don't you just apply right now, and you'll be put on the waiting list, and you'll have time to apply to law school and figure out the other things you want to do. So I applied to Bates, and I think within 4 months I was accepted.
Oh,
and
wow.
They wanted me to start in the fall, right after I had graduated from ASU, because they have a certain criteria to be admitted into that program. You have to have, each year of work in a lab counts as a certain amount of points, and then a degree counts as a certain amount of points, and then you have to write an essay. That at the time, Dr. Ken Kais was the professor, and you get a certain amount of points for the essay that you write dictating why you're interested in going to that program. So whatever it was, all of those things combined expedited me to the top of the waiting list, and I was admitted. And so I was like, okay. I had a summer off, and went home to Coeur d'Alene, Idaho for the summer, and then planned my move to Tacoma, Washington, where Bates was, and started the program there. So I did have different plans, but I started that program with Dr. Kais, and realized even just in the admittance process, they have you take a dexterity exam and some other things. And I realized that I was very skilled in that area, and I didn't know it. I had never really played with it other than what to me was work at my dad's and things that I was just very familiar with. I didn't know that that was a skill at the time. And so I loved the program there, working with the patients. For the first time, I had more of a hands-on with the clinic and with the patients as an adult rather than a child, and realized that I really enjoyed it, and that I was very good at it. And so the combination of those two things, I earned a scholarship while I was there at Bates, and I became very close with Dr. Kais. And so I just gave my all to that program, and I learned a lot, and just continued in that field ever since.
Wow. And so you never, once you started at Bates, you never looked back.
No, yeah, that's right. I carried on in the same field, and I ventured out here and there, and not only looked for, but was presented with different opportunities all along the way. So I've been at a couple different clinics, a couple different companies. I've seen a few different areas. 3G Dental Pros was actually a business that I started just last year, and I wanted to do a mobile service, a mobile denture service, with a vision to serve patients who, from what I saw, weren't able to get the care that they needed because they were homebound.
Wow.
So, for example, rehabilitation centers, hospitals, and mostly a lot of hospice patients, where whether it be family or they were alone and they only had caretakers, but that a lot of these patients could use the care of a denturist as especially in their last years of life, but a lot of people didn't see the value in it other than myself to give them that quality of life at the end of their life. And so they couldn't bring them into a clinic. Like, I'd get phone calls at the office, like, oh, can you come here? Can you come to the hospice home, or can you come to the hospital? And we were not able to do anything like that. And so in my mind, this is a service that needs to be offered. And so I created it. And so I launched just lately, well, I guess, yeah, last year, 2019. But then I had received a job offer in Boise, and I put it all on the back burner, and I relocated, and I've been in Boise since then. So I still have the vision for it, but I've been waiting to kind of pursue it until I need to get a few things settled anyways, and that where I'm at right now is giving me a good opportunity to do that.
Well, that's fantastic. And so, before you were licensed, you already had 15 years in the laboratory. Again, you worked with your dad, and so when you begin this new, let's call it this new angle. You did mention that you had the opportunity to work directly with the patient and on a more clinical approach, but as an adult, and obviously with a lot more understanding. So how did that differ? How did this differ, or did it any, going from being trained, formally trained, and when you were in the laboratory with your father? What were the differences, and what changed in your perspective?
Well, a lot of the patient contact. So, of course, my dad, although he would invite me into the clinic with him often, and I could watch him perform impressions or different appointments. When I was a student, we're allowed to have the hands-on approach, and I could take the impressions for myself and touch the patient and be in their face, really in their space. There's a different level of respect and understanding with the patient-provider relationship, other than as a bystander or someone who isn't allowed, I guess you could say, because I wasn't allowed to do that legally, by do it for myself. It was a different type of empowerment and excitement that I felt like, oh, I get to do this. And this patient is relying on me as the provider to get them what they need and to help them. And so it became so much more valuable to me when I felt like I was helping somebody.
So you were 15 years in the lab, and in the last 6 years, you've been working a lot more with the patient, the hands-on approach. Am I understanding that correctly?
Exactly. Yep.
So you have 6 years now with developing your skills with the patients. Now, and I always like to ask whenever I speak to dental professionals about this particular point. When was it, or let's reframe this. We all see our work in one form or another, but as a dental professional, you're able to see the emotional impact and how you touch the soul. When did you experience this the first time, and what was it like?
As a student at Bates, I had a patient who was a survivor of throat cancer, actually, and had multiple surgeries. All his teeth were removed. He had, part of his tongue had been removed. He was in I had undergone a lot of different surgeries, and he came in. I had Dr. Kai supervising me during the consultation. but I accepted his case and said, you know, I'll do my best to make you a prosthesis that'll work for you. And I went through every step and completed the service and provided this gentleman with upper and lower dentures that worked for him, and his gratitude and just the way that he reacted to somebody paying attention to him and somebody putting in the time and the effort to work on a difficult case that he had even been told by other dentists or doctors that had worked with him that he would be using a feeding tube for the majority of his life, that he would have to do that he wouldn't be able to eat, you know, real food. And so that's what he thought he was set for the remainder of his life. And I was able to help him and his wife together with their gratitude. And I realized, like, I made this possible. My willingness to do it in the first place, or to try, and then to be successful with it, and to see their reaction. That was, you know, that's where the heart was for me. That's when I realized, like, this is amazing to be able to help people, to give them something that they've lost. That's the best part of it. And that's what caught me. And I said, I could do this for the rest of my life.
Wow. Wow. And you were just a student. That's you hadn't even, you weren't even licensed yet. Wow. That is fantastic. There is something that
Right.
we had Mr. Michael Smith on the show, and he shared a story of his father stating to him as a dentist why he did what he did. And he said, because I help people, I can help people in a way they can't help themselves. And by what you're sharing it's amazing. It's amazing for a gentleman to be told he's going to be having to use a feeding tube for the rest of his life is very demoralizing. And for a person as yourself to go in and change his life, because that's essentially what you did in that in that progression of events is amazing. Now, when you decide to go into this, into the whole changing people's lives, or improving their lifestyle through this phenomenal gift of smile making, what plans did you have aside from, you know, the vision that you had? What other plans did you have that maybe you're possibly even thinking on still pursuing that you can share?
Well, then I didn't have any plans besides, you know, life happens when you're a student, when you're in school. And so I had gotten married and I had a baby actually while I was a student at Bates College. And my daughter was, she had health issues. She was born premature by 16 weeks. So she was
Wow.
born at like 24 weeks. She was
Wow.
2 pounds, and was in the hospital for an extended amount of time. And I was young and a student, and Dr. Kais worked with me through this while my daughter was in the hospital. I did an externship because we were in my daughter was in Spokane and the school was in Tacoma. He allowed me to do as an externship, working with at my dad's clinic and turning in all my completed cases to him. I was able to complete the program after that. So she got out of the hospital. I went back to Tacoma with her and my husband, and he did the stay-at-home dad thing while I finished school. And I didn't have any big plans other than to take care of my new baby. And I wanted to finish school, of course. I did. I graduated at the top of the class and took boards. And then in Washington, they'll let you take the board exam right away after you finish school. but in Idaho, you have to do an internship for a year, or 2,000 hours. I forget exactly what the requirement I was doing. So Idaho and planned to do that internship so that I could sit for the Idaho board exams. And I was just going to be with my dad and learn more. And that I didn't really have a vision at the time. I just knew that I was still a beginner and that I still had a lot to learn, and kept that mindset for a long time.
Wow. And you are licensed in 3 states, correct?
That's correct. Yes.
So you're, but aside from being a denturist, you're also a registered dental assistant. How did this happen?
I had maybe 2 years ago, I received a job offer from another dentist in North Spokane when I was working with my dad, who was looking for a denturist. He was making dentures. He had a small in-house lab. He needed some assistance. And I had previously I was working in Arizona. I had moved to Arizona, got my Arizona license, was working there for a while, and I had let my Washington denturist license expire during
Wow.
that time. So I moved back to Washington, resubmitted for my Washington license, and it was coming, but it wasn't there yet. And as I was working for this dentist, I applied for my RDA so that I could still be hands-on with the patients and still perform a lot of those
Wow.
tasks, to help him. And I qualified under Washington's guidelines for that title, so that I could continue working while I waited for my reinstatement in Washington.
Wow. So it was more about getting the mission accomplished more than anything.
Correct. Yeah. I didn't utilize it a whole lot as an RDA. I did some things, but really it was still denture work.
Wow. Wow. The loopholes I see. That's fantastic. So you are licensed, just to go back here, is Washington, Arizona, and Idaho, correct?
That's correct. Yeah.
Wow. And that's just amazing here. And um so the Chicago show is coming along in a couple of weeks, in 2 weeks actually, in 14 days. And by the time our viewers see this, it's possibly going to be either it's going to be either, yeah, it's going to be after the show, absolutely. But what are you going to be out there, or do you usually go to the Chicago show?
I've never attended. That's the one they call Lab Day, isn't it?
That's correct. Lab Day. Lab Day Chicago.
I, yeah, I haven't attended it myself. Every year, for the most part, I go to the Idaho Denturist Association Conference. I go to the Washington Denturist Association Conference, and I go to the National Denturist Association Conference. So each year I'm attending 3 different conferences, receiving continuing education, mostly at all 3 of them,
Right.
which is necessary for my licensure. And on top of it, my dad attends 2 of them. And, a lot of the friends I've made in the profession, I get to catch up with. So I haven't fit Lab Day into my schedule yet, but I would love to be there. I know some of my favorite technicians that I follow on social media and that I know of attend, and it would be great for me to take the time to get to that.
Absolutely, it would be. And talking about fitting into your schedule, so you're a mom, and you
I
are
am. Yeah.
also a dental professional, but you also have another hobby. You compete.
Yes. I'm a bodybuilder. That is my hobby on the side. Yeah.
And how much success have you achieved there so far?
I've been competing for going on 5 years now,
Wow.
and I've been successful in it. I always, for the most part, have taken like a top five placing
Wow.
at NPC shows, which are regional events. Just this last season, I took my first place and a second place. I competed in four classes. I got a first, a second, a fourth, and a fifth, which was phenomenal. I was very
Congrats.
happy with that. So thank you. And so that's something I love to pursue outside of work. It keeps me healthy in body, mind, and spirit, and always has a goal in front of me. Just it helps stay very diligent and dedicated.
Absolutely. And what do you have lined up in the future in your dental professional career? Is there something that we should be keeping our eyes open for?
Well, currently I'm working for a company here in Boise who uh, it's very exciting here. They're working on some of the new digital dentures and 3D printing, some things that I've only seen at continuing education courses. And that I haven't had the pleasure of working with in person. So I'm loving where I'm at right now, and I have a great mentor here who's continuing to teach me things. But um, my own business, the 3G Dental Pros, is still active. I just haven't put it into action yet, but I will at some point in time. So that's something that I plan on pursuing greatly in the state of Idaho to start with. And since I'm in Boise now, I've been considering branching out a little bit. Maybe I'm not sure yet how I'm going to proceed, but something will come of it. And eventually, when my father retires, I'm sure that I will take over some of the work that he's doing as well, which will keep me very busy. So he's not about to retire, though. He loves what he does, and he is full force with it every day. So
Continuing the legacy. That's definitely
yeah,
fantastic. And so
absolutely.
your progression has not been an easy one. You have had to make adjustments, and also things happening with your daughter. You have found the way to victory, and finishing your studies and getting all these different certifications, being on the top of your game in terms of your development and also what you've achieved, and even moving into other aspects and growing in other aspects in your life. What words would you share? What concepts would you share with someone that is listening to us today in order to inspire them and encourage them to keep moving forward?
Oh gosh, for anyone, I mean, if it's dental related or not dental related, whatever it may be, if it makes you feel good and it's helping somebody else at the same time, don't ever give up on it. Um, and these things, when it comes to you, and it's well received by you and well received by the people around you, just allow yourself to blossom, allow yourself to go where you're celebrated and where your personality or your skills take you, and just really embrace it. So if you have a passion for it and you're good at it, pursue it. I never knew. I didn't know that I would be talented in this area. It surprised me. So so I wouldn't have pursued it, and I take advice, I take advice from my mentors. It's a big part of my life to be able um, to follow somebody else's lead and to learn from the people around me that have just given me great guidance to help me be not only successful in what I'm doing, but happy doing it.
That's fantastic, and I'm so privileged on the opportunity of hearing your story. Amazing story. We are very inspired here at the Dental Today podcast. And how can our followers follow you on Instagram, Facebook? Where can we follow you?
I am 3G Dental Pros on Instagram. Haven't been super active with it because I've been busy in the clinic, but I plan to put more time into it. And I'm always happy to chat with anyone in regards to where they're at or where I'm at or where they want to be or anything that anybody wants to show me too. I'm just kind of an open book and happy to communicate. So that's a good place to start.
Awesome. Ladies and gentlemen, we have been honored by having Mrs. Amanda Rowe on the show. Amanda, thank you for coming on the show. Go follow her, send her smiles, send her comments, and welcome her, and also send her invitations so that she can join us one of these days in Chicago. Amanda, fantastic having you on the show. Thank you for coming on.
My pleasure. Thank you for having me.
Ladies and gentlemen, till next time.
Bye-bye.